Section 7 is on bleeding. It introduces the third stage of labor where the baby has been born, but the placenta has not been delivered yet. This time period is the most critical for the mother. This section will answer questions about how to deliver the placenta and how to stop bleeding.
Years ago, when I started my midwifery practice, I went to a kind of workshop, and Dr. Warden, a doctor in Ogden, was there, and he talked to the midwives. And he said that the most important thing that a midwife needs to know is how to stop a hemorrhage. He said you should never go out on a birth. You should never deliver a baby if you don't know how to do that one thing. Now, Dr. Warden did home births up in the Ogden area, and unfortunately, the doctor that delivered me once in southern Utah, and Dr. Warden also, the Utah Medical Association closed him off, okay? And Dr. Plunkett went to Arizona, I think, and Dr. Warden stopped practice, okay? And that's unfortunate. You know, women need choices, all sorts of choices. In other words, when the options are small, and they have been in Utah, but they're opening up a lot better now. That's really unfortunate. Okay, so hemorrhage. Indeed, third stage is the most critical for the mom. And the first thing you need to kind of concentrate is delivery of the placenta. Do you know the signs that the placenta is separated? The placenta is up here in the uterus, okay? And it is right here against the mother's uterus, okay? And on this side, okay, are a lot of blood vessels, okay? Now, they do not go all the way through, but they kind of go through by osmosis, all the nutrition and the things that need to be done. But when this placenta comes off the wall, there's all these little capillaries and they're fed by this system, this river system, okay, on the mother's side of blood. And that is where the bleeding comes after the baby is born. It's when the placenta comes off. Now, how do you know when the placenta comes off? What are the signs?
The cord lengthening, it'll get longer.
The cord gets longer. Thank you, Riley.
A gush of blood as well.
And there's going to be a separation gush, is what it's called. And so there's going to be some blood come out, and that is going to vary from woman to woman. In other words, if she's a real heavy bleeder, you're going to get a lot of blood. If not, you may get just a little bit. The placenta could come down on where the cervix is and block any blood from coming down, so it's off and you can't see because it's blocking it. Generally, it happens in just a few minutes. In other words, it's not a long time. And actually, you can have a placenta come out and it's still pulsing blood into the baby. So it still has blood and oxygen inside of it, okay? But it can still be sending it into the baby. So, with your sharp eagle eyes and what you're checking out and what's going on, you're going to watch and you're going to see, and you're going to say separation gush, okay? And you're going to tell the person who's charting to put down the time, okay? You've also told, the charter has also got the time for when the baby's born and when you clamp the cord and all that kind of stuff. Okay. So if you see that gush of blood, you know that the placenta is off the wall. And so the mother at that time can push the placenta out. Now, different people do this differently, okay? One of the traditions, okay, in home birth, natural birth, is to wait until the mother gets an urge to push the placenta out. And that can be stimulated by having the baby nursed, okay? But babies usually take a few minutes before they feel like they want to nurse, okay? But when the mother has an urge to push, then she can push the placenta out. And most women can do that without much problem. I happen to be a little cautious about it. As soon as I see the separation gush, I want the mother to push whether she feels like it or not, because of the fact that I want the placenta out of the uterus. With the placenta in the uterus, it is a mass, okay, that holds that placental site out, open, so that you're going to get more bleeding from it. So I like the placenta to be born and out. And also, some women, especially who dilate really fast at the end, you know, you get to 5 and, 5 minutes later, you're pushing the baby out, okay? Their cervix went out like this, and it'll go in like that, okay? And so the placenta can get trapped kind of in there. So I like to get it out. Now, I have a birthing stool. Here we go. This is a birthing stool, okay? You put check sheets on it and around it and so forth. So here the woman is sitting on this stool, okay? And you're going to get your bowl out that you have for placenta. Oh, I've got to fix that, okay? A bowl out and put it under her. And what you're going to do is you're going to take your hand and put it above the pubic bone, because sometimes the placenta will get caught right here. It'll get caught right against here, okay? So you're going to take your hand with one hand and you're going to push in right above this pubic bone, so this placenta doesn't get trapped like this. You're going to push in, and we got to get this out, and okay, you're going to pull toward the back, not toward the front. Don't pull the placenta this way. You're not going to have as good a luck. Pulling it toward the back is the easiest and best way, so that the placenta will come down and out, okay? And I am not opposed to pulling on the cord. It works and it helps, okay? Sometimes. And you can tell whether the cord's going to give on you or not, okay? If you've got a nice, good-sized cord, it's pretty tough. But it's not going to come loose. You can tell it. You can tell when it starts to give. So I have pulled on placentas as hard as I could. I'll have to tell you that. And they came out. How's that? I like the placenta to come out, and then I put the mom in the bed, okay? And just put a chuck sheet under her and stick her on the bed, because I like her to lay down after the placenta is over. If she starts to hemorrhage, if she starts to bleed, the first thing you do is you get her on the floor. You get her on the bed. You get her straight down. You do not let her be upright, okay? You get her down, okay? And you can be quite firm. We have to get her down, okay? Get her down on the floor, okay? Whatever it is. And then you go for the mother's uterus and you grab it and you push it down, okay? Making that placental site, the site where the placenta was attached, making it smaller so that the muscles cut off the bleeding in that area. The most common reason for hemorrhage is uterine atony. In other words, a boggy uterus. That is the most common thing. And so pushing down this way and this way, just grabbing the uterus with the hands and holding it really strong makes a difference. Okay? Yes.
From the outside, is that what you're doing?
From the outside. That's what I'm talking about. Mm-hmm. Yeah. You can hold that uterus down for, you have to take turns because it takes a lot of muscles, okay? So maybe you're holding it for 10 minutes and then you let off and then you, for a couple minutes, and then you push down on it again and see how much blood you're getting. So if you have a lot, then you push down again and you hold it. And you take turns with everyone in the room and you check to see how hard you have to push, okay? You have to push really hard. You can push really hard, okay? In other words, to bruise you. I could bruise you, okay? You push down. I've held uteruses down for an hour or so, okay? Before the body finally responded and getting it. The more blood you lose, the harder it is to cut it off. So that means you have to work fast. It's just like the same with resuscitation of a baby. The longer you wait to resuscitate the baby, the harder it is going to be to get the baby going. And so people who do out of hospital births, okay, are really good at responding, watching, noticing what's going on, and going for it and taking care of it quickly. Not, oh, I wonder how much she's going to bleed, okay? Whatever. And I delivered 1,000 babies before I became licensed, before we had a licensure in the state of Utah. So I could carry Pitocin, which stops bleeding. And I never carried Pit before that time. And so I did over 1,000 births without Pitocin. And I was very good at helping them have good nutrition during pregnancy as preventative. That's really important. And then I would really watch this area because, as I say, I didn't have any drugs I could use to make the uterus go down. And Pit is really nice if you need it. If I would have had it all that time, I did transport a few people to the hospital for some IVs or something like that they needed at that time. But it's nice to have Pitocin, I think. At this point, it is nice.
Can you give her any cayenne or shepherd's purse?
Okay, very excellent. Cayenne and shepherd's purse. Shepherd's purse is the wonderful herb for stopping bleeding, okay? And shepherd's purse is something that grows wild here in the spring, and you probably will learn how to do it at a thing. You just take the shepherd's purse, and fresh shepherd's purse is the best, okay? You take the fresh herb and you chop it up, and then you put, I have some recipes, okay, in here, but you put the alcohol in it, stick it in your blender with, I use 100 proof or 90 proof, whatever it is, Everclear, okay, and you buzz it in your blender and then let it sit for a couple weeks and shake it, okay? It is absolutely fantastic, and it is especially good to leave with a mother who is bleeding just a little bit too much or whatever to cut down on the bleeding, okay? Yeah?
So you just give it to her as a tincture?
Yeah, I give it in a tincture, and I would give maybe a couple dropperfuls in a little bit of juice, and then they can have a chaser of more juice, and then you can give it to them, so every 5 minutes, every 10 minutes, whatever. Now, cayenne is something different, okay? Cayenne does stop hemorrhage, but you need to really take it during the pregnancy. A capsule full of cayenne every day at the last couple months of pregnancy will really make a difference as far as the mother bleeding. I would not give cayenne at birth or by itself, okay? I would give it in a combination. I would not give it at birth if the placenta is not out, okay? But after the placenta is out, you can do it. And you can use the shock drink that I gave you, that recipe for shock, which is cayenne, which will really help. But the most important thing is taking cayenne during the pregnancy, and it will really stop bleeding. Now, if, for instance, you by any chance gave an episiotomy, and every few years I'll give an episiotomy, but that's about it. But if you do, or you have to, in order to get a baby out and she starts bleeding, if you put cayenne tincture straight on the episiotomy, it's going to send her through the roof, but it'll stop the bleeding. And women bleed more from an episiotomy than they generally do from birth, okay? So that is an option for using cayenne. Now, we'll get into breaches in twins, and I'll tell you a story of the twin thing and hemorrhaging, which I think is really important. That you should always, the most important thing you can do is get the uterus clamped down and hold it down as quick as possible.
Can I ask you a question?
Yeah.
About the cayenne, you said you would not give it if the placenta hadn't been delivered.
If the placenta had not
Why
been
is
delivered.
that? Yeah, I just want to understand those.
Because actually cayenne is an incredible herb, okay? But if the placental site is still open really far, it could cause you to bleed a little bit more. But as soon as that placenta is out, then sure. Now there used to be a big deal about midwives using cayenne, okay, during the labor and so forth. I would use it in the labor for some things. We'll probably talk about that maybe. But using cayenne, and it is Wise Woman Herbal. I don't know if you've come across that. She talks about it in there, how the midwives in Colorado use cayenne, and they found that after they, it did stop the bleeding, but the women in the end had more bleeding. And the reason is because the midwives didn't really understand what cayenne does. It will stop bleeding, but it does not cramp the uterus, okay? And you have to clamp the uterus in order to stop the blood flow. So they were expecting something more. But I would use cayenne in labor without any problem. It's just that during that time, I would wait until the placenta is born before I gave the mother shock stuff. Or I'd give cayenne in a combination, but I just probably wouldn't give cayenne straight during that time. Well, if a woman is ripped up by her clitoris, okay, that is a very, an area which has a lot of blood vessels, okay, and she is going to bleed like crazy. I would not give her cayenne if she has a rip there.
You would not?
Until it, what?
You would not?
I would not give her cayenne
And you
until that
wouldn't
one.
use it as a paste to put right on the
I
site
would,
itself?
you could put it externally on that area.
Externally you could.
Real good high there. Now, one of the reasons I like the placenta out is because I like to prevent hemorrhaging, okay? Also, I found that the mother does not really feel well after the birth until she gets the placenta out. She just doesn't feel as good. Then the mother can put more attention on the baby, and then I personally can get to repair as quick as possible if I need to do a repair on her. And because I don't use any deadening, and so if you don't use deadening, you've got to stitch really soon. You know, within 30, 45 minutes of the birth. You can't wait a couple hours. You have to use something by that time. They're pretty numb to begin with. So that's another reason why I like the placenta to be out.
I have a question. When you had babies that you were having to work on and resuscitate, what happened with the placenta? If something like that's going on, does the mother's body naturally kind of just wait for the process of dispelling the placenta while you're working on the baby, or does that happen in the same process while you have someone else down there working with the placenta while you're working on the baby?
Yep, that's why you need more than one person there to help with the delivery. Okay, so you got this person in charge. You go and take care of the mother, the placenta, and see how she's doing here. You resuscitate. You call out what needs to be done. Help the resuscitator call it out. Okay. So in other words, so you need people there to help in all those things.
How many mothers go into shock about that phase? And what does that look like?
So you have a mother going into shock about this stage, okay? Then of course I would give them rescue tincture, which does have cayenne in it, okay? But you would lay them on the floor, put their feet up, regular shock things, but you would make sure that they are not bleeding. And you know, it's really hard, but you've got to check the bleeding and what's going on. I remember doing a gal with her baby, and I couldn't tell that the placenta had detached, and this was quite a ways. And she had really strong abs. She had to work out. I mean, really strong abs. And I couldn't tell by palpating what the deal was, okay? But she acted kind of shocking, and there wasn't any reason for it, okay? And so finally I said, well, let's just get this placenta out and you'll feel better. And the placenta came out, and then a whole bunch of blood came after it because the placenta was down there on the cervix and had blocked it. So generally speaking, it's really nice. But, you know, some women are not going to bleed at all, okay? Let's face it, they're just not going to bleed very much. And let me see, I got a call one time from a do-your-owner in Alaska, okay? Someone knew me, whatever. They called me, and his wife had delivered the baby the previous day, okay? And the placenta was still in, okay? Had not been delivered. And she wasn't bleeding or anything. So, man, she was in pretty good shape. This is what I told him. I said, stick the chairs up like we did with the delivery there. Okay, stick her on the chairs like this. Take your hand and put it up above the pubic bone and push in. Take your other hand on the cord and pull it back and tell her to push and pull it really hard, okay? Because, you know, how open was her cervix by that time?
Not open at all.
But it worked. It worked just great. I had a do-your-owner from Missouri once call me. I delivered some of their previous babies, but they were in an area where midwives were illegal. And so they did it themselves. And he told me that his wife had had the baby 2 or 3 hours before, and the placenta hadn't come. And so I told him the same thing. Works like a charm, okay? It gets that thing out, okay?
So she had that question, what if the entire placenta doesn't detach and part of it is left up in the mother?
That's a good question, okay? Let's say that the placenta comes out and you inspect it. We're going to inspect the placenta. Yeah, then you've got to go up and make sure that you've got it all. So let's say you have a regular retained placenta that is all together, okay? You're going to have someone hold the cord for you, okay? So You don't have to do it with your hands. You're going to take your gloved hand and you're going to walk up here, go through. Usually they're just sitting there behind the cervix, okay? And if it is, you can grab it like this and pull it out, okay? But if it's on the actually side of the uterus, you go up with your glove and go around to the side and go like this, okay? And detach it and then pull it out. And if there's normally if you had something like that, you take someone into the hospital for a D&C. In an emergency situation, you're going to have to go up, cup your hand on the mother's uterus, go up and scrape it a little bit with your hands. You can take a piece of gauze and go up and scrape it. And then you'd want to put your mother on infection fighters, okay? Vitamin C, the good herbs that will kill infection, and all those kind of things. And let's say this, okay, that you have a mother who has not delivered the placenta and is bleeding heavy. You better go up and you better get that placenta and you better get it out, because you have got to cut off the bleeding, okay? That is just essential. Now, when I first started midwifery years ago, the thing was, you do not go up into the uterus and get a placenta, because you really may cause a problem and the mother may die. Well, I would say if you don't, the mother may die. So if she is bleeding heavily and the placenta is not delivered, you need to go up after it and get it out. Now, let's talk about the mother after she has the baby, okay? You need to always give this instruction to the mother before you leave. If you start to bleed heavy, a little stream, okay, it is because you have a clot in your uterus, a blood clot. And the blood clot is keeping that placenta area open where the placenta was attached. So what you have to do is push that down on your uterus, push that blood clot out. A good place to do it is on the toilet, okay? You should tell your mom every time she sits on the toilet to rub here and push and make sure that she doesn't have any clots. If she has clots, they'll fall out. As soon as she gets rid of the clot, the bleeding will cut down and she'll be okay. Now, who do you need to watch out for as far as bleeding goes?
Redheads bleed more, don't they?
Redheads, you got it. Redheads have an iron molecule that makes their hair red, and they have a little iron molecule for their freckles too, okay? And that means that they need more iron than normal women during their pregnancy. It doesn't have to be, not synthetic iron, because that's a poison, okay? But there's a lot of iron in the herbs, and desiccated liver, I like that. That's dried liver, ups iron. Molasses is fantastic for building iron. There's a lot of things. But redheads and light blondes. The other thing with that group is that they need more protein during their pregnancy in order to make a strong placenta. Their placentas are generally weaker. So they need to eat a little more protein during whatever. I need to show you how to inspect a placenta. That goes with this series, but we'll need to stop the cameras and maybe I'll do it over on the table.